Are you interested in getting started with exercise, but you're worried that your health problems might stand in the way? I'm Dr. Jody Freedman, a chiropractor at Willowbrook Chiropractic here in Langley, and today I'm at Live Well Exercise Clinic in Langley, and I'm joined with Sarah Gilbert, CEO and founder of Live Well, and we're going to talk about how you can get healthier, even if you have diabetes, obesity, or different types of heart conditions. Thanks for having me.
Oh yeah, thank you for coming to our beautiful facility.
Yeah, perfect. So, a lot of my patients want to get healthier, but they may have some of the conditions that I just mentioned, and they're just hesitant to get started with exercise then. Where do you usually get started with those people?
You know, I think that it is so common for people to be a little bit scared to get started with exercise, usually because they don't really know what exercises they should be doing, at what intensity, and there's a little bit of fear around, I have, whether it be joint pain or high blood pressure or blood sugars that they're dealing with, what is the right amount of exercise for me that's safe, but also that's effective. And so I think that creating an environment where people can be part of a program, first of all, and that program has in it all of the components that people need to be successful. And the first thing that we know people need is accountability. And that's really an appointment, just like people have an appointment with you, and so they show up. We make it at Live Well so that they have an appointment with exercise and with us. And then our members show up and they know it's in their calendar, right? It's scheduled and people know when to show up. The second thing is expert guidance. People want to know that they're working with a healthcare professional who can help to give them exercises that are suitable for themselves. And then being supervised. People want to know that not only are they getting good exercises, but they're supervised every time they come. That we're here to adjust things, we're here to make sure you're doing the exercise right, we're here to support you and to champion your potential to exercise regularly and get all the benefit out of it.
Yeah, that's great. And again, those are a lot of the things that I'm often talking about with patients.
I'm sure,
but it's really hard for them to do on their own. So again, it's great to have a facility that is taking all those things into account then. So a lot of our patients also have back and neck pain. And again, we do a great job of treating those things there. But really when we combine treatment with exercise, that's really when the magic happens. So what do you guys do in terms of, say, modifications for someone with back or neck pain when they're approaching exercise?
Yeah, and any type of pain can be a little bit hesitant for somebody, again, to start exercise, right? The nice thing about the Live Well Exercise Clinic program is that all of our members come and they have a customized exercise program with us. And we work with the other healthcare professionals that they are seeing. So what are the things that we are learning about them from their chiropractor, from their physio, that we can work into their exercise program, and really working on functional movements, the movements that are going to help them in their everyday life. So for example, somebody who has back pain, we're not going to start initially by loading an exercise. And by that, I mean using resistance bands or weights. We're going to first make sure that that person has the strength and the support in all of the surrounding muscle groups to be able to do that movement properly, and to obviously avoid anything that does cause pain. And slowly over time, what that does is that we avoid pain, we strengthen our muscles, we start to also build our own confidence that we can do more, and we start to be able to do the things in our life that are the functional activities, which are the things that we identified when we had the back pain. We were trying to do things in our everyday life that caused pain. Now we're starting to feel better, and we feel that kind of self-efficacy around that. For sure. And it's all about function, right? Then, so because a lot of people come to us with pain, but really when we ask a few more questions, it's really about all the things that they're not doing or that they wish they were able to do. So it sounds like you guys are on the same page in terms of really getting people back to doing the things that they really enjoy to do. Well, thank you so much for providing all that information and having me at your clinic today then. So people who are interested in getting started with Live Well, what should they do? Yeah, our members tell us that the best way to really understand what we do at Live Well is to come and experience it for yourself. So we welcome people to book a free hour with us. They'll work with a clinical exercise physiologist and get those custom exercises that are going to work best with them, and we'll introduce them to the program. So they can book a free session at livewellclinic.ca.
That's great. And if you have some back or neck pain, maybe some shoulder pain that's holding you back from exercising, you can either reach out to myself, Dr. Jody Freedman, or Dr. Robert Armstrong. We're always happy to help.